Good day, ma'am. Today I will be performing the wound care. So what are the assessment? So first, you need to identify the patient using at least two identifiers.
So may buntag ma'am, ako day si Ima Cruz G. Magunot. So karon mag-assess ko sa imuhang samad, magbuhat ko og wound care. So, kano sa tong birthday ma'am?
December 19.
Pangalan na to ma'am?
Angel Zarina.
Pwede matanaw? Ang wristband. So, okay. So, sunod, akong buhaton ma'am is mag-review ko sa order sa irrigation type and solution to be used. So, ang order diri sa doctor is normal saline lang siya, which is good. Wala, dili kailangan og mga isotonic o mga alcoholic something. So, dili kay ni sakit ma'am. So, next is assess patient's level of comfort. So, unsay pamin na to karon ma'am? Kumusta ang atong samad karon? Nagangulngol siya. Na siya yung mga sudden pain, ang ayo. So, assess the patient for history of allergies. So, unsay mga nabi kay mga allergies sa mga gapas ma'am? Mga solutions na kay allergy na sa mga gauze bandage. So in the planning, so first thing to do is identify the expected outcomes of the assessment. So ma'am, karon magbuhat ko wound care sa imong samad, and then expected na to ani na malimpyo ang imong wound and walay mawala ang katong mga nana katong mga kugang-kugang niya or usa ba kato ma'am. Also po para mag-deter ang spread sa microorganisms around area sa wound nimo. Next is administer analgesic. So ganina di ba ma'am 30 minutes before 30 or 45 minutes ganina di ba nag-take ng analgesics ma'am, so okay na. And then educate the patient with the patient and the family about the assessment. So karon ang wound care na ginabuhat ma'am is kailangan na siya para sa wound nimo para dili siya mag-infect kay magpunto mo gud nana sa samad, so kailangan na to siya i-irrigate, tubigan na to ana atong hugasan in a way na dili pud ka masakitan. Okay ma'am? Okay. Sabot pa ta ma'am? Okay, good. And the next is gather the supplies of the of needed. So first, septic gloves, the biodegradable bag, the syringe, the angiocatheter syringe for the irrigation, mask and my PPE, the alcohol, and the solution that I will use for irrigation, and then the excuse me, the kidney basin for irrigation also to
So in the implementation, first step is you perform hand hygiene. And then next is you will forms a cut on waterproof biohazard bag and places it near the bed. So for your discards, like your the old dressing, the glove that you will use, and other things that you will discard after the procedure. And then next is applies PPE. So your mask, face shield, and your gown. And then uses sterile precautions if needed. And then next is you discard all dressing and gloves, and then performs the hand
so
hygiene.
first after doing the applying the PPE, next is apply the clean gloves and then the exposes area near the wound only. So ma'am, tagalan na to ang dressing ma'am, expose na ko yung wound. So first thing is you irrigate the irrigate the wound with wide opening. So first is you fill syringe with the irrigation solution, and then put the kidney basin under. And then hold syringe tip above upper and wound and over area being cleansed. Then flush wound using continuous pressure to the wound, draining until the draining. Okay lang yun. Dili sakit lang. Kailangan ko na siya ma'am kay yung mga nana, ang galon mo ba? Para dili ma-infect yung mga summer. Ano na siya ma'am para dili basig ma-appetit, dili makamot ma'am pag ma-infect yung mayo. Sabat na ma'am. Good. So in step 7, as usual, irrigate, refill the angio catheter, then irrigate the wound and pinch the tip of the syringe for it to be stationary when irrigating a small opening wound. Wala ba siya nag-updose, ma'am? Pag mag-irrigate, ma'am? Ayun. So the next type of wound care is the handled shower. I'm sorry because I cannot perform the handled shower kay we don't have a shower, ma'am. So ako na lang siyang i-state sa imo ha. Akong i-state na when that assessment of the wound care with handled shower is you let the patient sit to the area and then get the handled shower and make sure that the water is warm and then shower it for 5 to 10 minutes the wound of the patient, and then before you do that, especially you will perform a hand hygiene as always, and then apply clean gloves again, and then your PPE also, and then there you assess the wound care with the handled shower. So in this step, ma'am, step number 9 is you katong mag-collect og culture sa wound sa patient. It is important, ma'am, because the labs maybe want to, if necessary, the labs want to know or to analyze if the wound of the patient is infecting around the area of the wound, and or maybe severely infected depending on the situation. So ma'am, magkuha ko culture sa imong wound kay para ma-analyze sa lab na kung infecting ba or nag-aayo na imong sabat lang ha. So by collecting a culture of the wound of the patient is you use a sterile cotton buds like swab test. After collecting the culture, you dry the wound of the patient, and then apply the new dressing of the wound. Ma'am, mag-apply na ko dressing ha. So by applying the new dressing, you need to put initials to the dressing So after labeling the dressing of the patient, you need to for them to track when it was changed and who changed it. So next is you remove the PPE. And then perform hand hygiene, and then doing the evaluation is have the patient the level of comfort. So ask, ma'am, kumusta itong paminaw karon, ma'am? Usay paminaw na ito na nailisdan ang dressing sa samad? Wala ba siya nagangon-ngon sa ba? And then inspect the dressing if there is inspect the dressing once every shift as required to track if the dressing of the patient has changes or nagdadaot, ana ba? And then observe for presence of retained irrigant. So i-check nimo kung nabay basa-basa ang dressing sa patient, and then most importantly is you note all of the observance or all of na-observe nimo sa wound sa patient. So, sa all dressing ko. So, as observed ganina, na ay blood and also na ay nana. So, karon na irrigate na siya. So, supposedly limpyo na siya. So, that's all, ma'am. Thank you.